Hello there, my name's Dr Andrew Pennington and I'm the practice principal and an integrative general practitioner at Sanctuary Lifestyle Clinic in Waitara in Sydney. Today I want to talk to you about how to use exercise to treat and potentially reverse your type 2 diabetes. In particular, I'm going to talk about high intensity exercise. Now, guidelines around most Western societies suggest that we should be involved in doing 30 minutes of moderate intensity physical activity every day, and I would certainly agree with that. But when it comes to type 2 diabetes, you can actually get some significant improvement, even greater than the 30 minutes a day, using high intensity exercise. And I'm going to talk a little bit about the way that I talk to my patients about how to do this. It's actually quite easy. You can do this in many ways. There are many exercise modalities that are amenable to high intensity exercise, whether you want to do it via swimming or via walking and running or jogging and running or even boxing or cycling. There are a lot of ways you can do it. But the principle here is that when we do high intensity exercise, and this is exercise where we're exercising close to our limit, around a 90 to 100% capacity of effort, this actually has a significant effect on the muscle's ability to take up blood sugar and take it out of the bloodstream and put it into the muscles where it can be utilized for energy production. And when we do this high intensity exercise, it actually fools in some ways the muscle into thinking that it needs to do more effort than it is, and it upregulates the sensitivity of the hormone insulin, which pulls blood sugar from the bloodstream into the tissue. So interestingly, studies have shown that we really don't need to do very much exercise at a high intensity level to get the benefit here. It's actually about 6 minutes every week. Do you think you've got 6 minutes? 6 minutes is really not a lot of time. Now, I would say that 6 minutes just doing high intensity exercise might not be the best way to approach it, and that's why I like the concept of high intensity interval training. High intensity interval training is basically where you start off exercising in whatever capacity you want to do. I find possibly the easiest way to do this is on a stationary bike. So imagine if you've got access to a stationary bike, either at a gymnasium near you or at home, you can easily adapt this into your setting. And the way I explain to my patients is I want you to start getting onto that bike and going at about a 50% effort. So, and do that for about 2 minutes. And of course, you should warm up before you do this, a little bit of a stretch. And I should also mention, of course, check with your doctor to make sure that this is appropriate for you, your medical condition, before you engage in high intensity interval-based training. But assuming that you've got the medical clearance and checkup from your doctor to do this, then start with about 2 minutes of 50% effort. So you're sort of strolling along there. It's not particularly difficult for you to do it, but you're just starting to get your heart rate up again. And then at the 2 minute mark, I want you to really go whole hog out, really go hard, and do that for 20 seconds. So you're strolling on and you're really going as fast as you possibly can, or close to as fast as you possibly can. And at the end of 20 seconds, just slow it back again to about a 50% effort and continue to do that for about 2 minutes. And then again, go back into another 20 seconds of going really, really fast, and then slow it back to 2 minutes. So if you sort of add this up, if you did that block of about 12 to 14 minutes a day, which is very achievable, I think, you've actually got at least 1.5 minutes of high intensity exercise. And all you need to do is do that 4 times a week. Pretty simple. I encourage you to give this a go, and you'll be surprised at how much improvement you can get on your diabetes level. You may even surprise your doctor. Of course, as I mentioned, check with them that this isn't appropriate for your particular situation, that you don't have any injuries that preclude you from doing this, or you don't have cardiovascular disease, which may need to be treated prior to doing this level of exercise. It's a great way, I find, of improving blood sugar control in someone who has type 2 diabetes, and certainly part of the potential for reversing this condition. If this has been beneficial to you, please share this video. If you'd like to know more principles about how lifestyle strategies can actually treat or prevent chronic disease such as diabetes, please click on the descriptor below and you'll see our website, Sanctuary Lifestyle Clinic. I have a few links to useful information there, and you can also book an appointment to see me or one of our practitioners who can assist you on your journey to improved health. You can also go to our Facebook page and click on the Book Now button. Just search for Sanctuary Lifestyle Clinic in Facebook, or you can call us on 1300 723 070.